Hey everyone, Khalid Maidan here, welcoming you back to Clinical Physio. Here's our top 5 tips for challenging yellow flags linked to the diagnosis of low back pain. But before we get into the top tips, we need to examine the cause of these yellow flags in more detail. So first of all, back pain has developed a stereotype for being very disabling and as a result very scary. Diagnosis forms a key part of clinical reasoning. But for patients with low back pain, certain diagnoses and certain terminology can cause huge psychological trauma, stress, anxiety, and very real changes in lifestyle, which all come under the term yellow flags. So how does this happen? Let's start with the term crumbling spine, which is a term often used to describe lumbar spondylosis, the natural process of osteoarthritis in the lower back. But patients labelled with this awful terminology hear the word crumbling and think of their spine as fragile, almost disintegrating. Another horrible scary label to describe lumbar spondylosis is degenerative disc disease. Osteoarthritis is certainly not a disease. There's no bacteria, there's no virus, you don't get ill or need to stay in bed, and you certainly don't need to rely on buckets of medical intervention with hospital admissions and antibiotics. But when patients hear disease, they think of something harvesting, something grave and sinister, which can completely change how they act and move on a day-to-day basis. Speaking of discs, by the way, there are many overzealous ways of describing disc injuries. People are often told that they have popped a disc, burst a disc, ruptured a disc, and perhaps most commonly, slipped a disc. The words popped, burst and ruptured all make people think that their disc has physically split in two, whereas patients diagnosed with a slipped disc have genuinely asked me on occasions, how does it move back into your spine if it has slipped out? The last diagnosis I'm going to talk about is sciatica, which is a very genuine diagnosis, but is diagnosed so loosely. The number of times someone walks into clinic with pain in the front of their leg who has been told they have sciatica. The problem is that sciatica is stereotypically very disabling, so even though patients may not have this condition, they still slip into a protection mode in fear of the dreaded sciatica. So those are the psychological effects of these scary labels. The physical effect is that people fall into a state of protection, as we said, in fear of their spine crumbling further or another disc slipping out of place. As a result, they develop stiffness and weakness because they don't lift as much, don't stretch as far, or exert themselves as often, which potentially leads to more pain and dysfunction than your patient may have already had. So that's what we need to look out for as clinicians. Here's what we can do differently to help them. Top tip number 1. Listen out for the scary labels, such as the ones we have described previously, and certainly don't use them in your explanation of your patient's symptoms. Top tip number 2. If your patient has been given a scary label, make sure you explain why the label is not entirely accurate or how it can be overzealous. Make sure they don't think that their spine crumbles like a biscuit. Top tip number 3. Explain what the effect of a scary label might be. Your patient may well relate to the scariness of that label or the psychological effect it has had on them. Explain how the scary label can lead to protection, stiffness and weakness and how you're going to try and help them avoid this. Top tip number 4. If your patient does have simple mechanical low back pain, tell them this. Normalise their symptoms. Explain that their symptoms are extremely common and that many people do recover from back pain to lead a normal, healthy life. And top tip number 5. Make every effort to reassure your patient if there is nothing serious going on. It will give them confidence that they should not have to worry about their back pain, just like point number 4. As a result, they are far less likely to develop any negative psychological thoughts, which will improve their prognosis of recovery. So that's all from me. Thank you so much for listening, and for all our top tips, join us again at clinicalphysio.com.